Hey everyone, in today's video we'll be discussing about diabetes mellitus. So let's get started. Everyone knows about diabetes mellitus, its causes, insulin resistance and all these things because we Google it so frequently nowadays that we know everything about it. We'll have just brief introduction about diabetes, its symptoms, and let's move on to the tips to control blood sugar. So here we go. Statistically, around 7 crore people in India are affected by diabetes mellitus, and if we take on a global aspect, around 60 crore people are affected with this. Now quickly moving on to the signs and symptoms. Before moving to the signs and symptoms, let's know the gold standard value of blood sugar levels. So if the blood sugar levels are between 70 to 110 in the fasting state, then it is considered to be normal. Something beyond 120, it goes to pre-diabetic stage, and in the postprandial level, anything beyond 140 is considered to be diabetic. Looking into the signs and symptoms of diabetes mellitus, the commonest ones are increased thirst, increased hunger, increased sweating, weight loss, easy fatigue, recurrent urinary tract infections, and because of dry skin there can be itching, progressive muscle aches, joint pains, slow wound healing, loss of sensation and numbness in hands and feet, dark patchy skin which we called as acanthosis nigricans, is usually found in the skin folds and behind in the neck region. Along with diabetes mellitus, there can be other comorbid conditions like PCOS, high blood pressure, and in turn high blood pressure and diabetes mellitus, they both go hand in hand and they affect the kidney and the circulation, where the brain can be affected by stroke, and eyes are being affected where the patient has blurred vision. Now what are the 3 tips to manage blood sugar? We call them in short as LED, the LED bulb which we usually use. Though no, this is not the LED bulb. This is lifestyle, exercise and diet. Lifestyle refers to the modifications in sleep patterns, stress management and exercise. These can be of 3 types. It can be flexibility exercises as in yoga, or it can be strength training exercises where the muscles are being toned up, or it can include aerobic exercises like walking, jogging and swimming or cycling. Calf raises is one such exercise which helps in reducing blood sugar. How long should we do exercise? WHO recommends workout or exercise for minimum of 150 minutes per week for optimal health. So is it necessary or is it sufficient for everybody? The answer is simply no. It depends upon the daily requirements of our body, how we work and how we in turn burn our calories. So even that matters. Depending upon the age, depending upon the lifestyle, things can be modifiable. For some, 30 minutes of walk is sufficient, while for some, flexibility exercises can be best. Diet plays a major role in management of blood sugar. Use of salads before meal is a important aspect in controlling carbohydrate intake. Are the choice of preferred grains in diabetes mellitus, and please cut down on the cookies and biscuits which we usually have with tea. So what happens is when people sit down together, they have a cup of tea along with a handful of biscuits. So please avoid that. Please avoid taking sugars. Sugar can be in any form. It can be in soda, it can be in fruit juices which are almost in containers packed in supermarkets. Avoiding fruits like mango, chiku, grapes and all these things are beneficial for controlling blood sugar. Taking fruits itself in moderation is the key, because fruits contain fructose in it, which is again sugar. Going to the home remedies, there are multiple home remedies beneficial for controlling blood sugar. Some of these are fenugreek seeds, which are soaked at bedtime and taken in the empty stomach in early morning, and moringa leaves powder is one such beneficial home remedy. Taking tulsi leaves, basil leaves is also one such home remedy beneficial for controlling blood sugar. Taking ACV diluted in water is also beneficial. Regular monitoring of blood sugar levels and maintaining a food diary is a good practice, because this helps us know which food causes blood sugar spike and which food is beneficial to us. With this, we have come to the end of the video. Hope this has helped people know what things can be beneficial for managing blood sugar. And seriously, diabetes mellitus is reversible if we follow the LED properly. So we hope just this will be beneficial to you all. Thank you. Stay tuned. Bye bye.